Hi, Dr. Marcia Sirota here, and today I want to talk about the difficulty of diagnosing attention deficit and attention deficit hyperactivity disorder. Now, this is a diagnosis that's been around for a while, but it's being diagnosed more frequently lately. And I was thinking about how lately I've been diagnosing quite a few grown adults in their 30s, 40s, 50s, even 60s with ADD and ADHD. And I was thinking, I wonder why these people didn't get a diagnosis earlier on in life. And the reasons I came up with are two. The first reason I think that people don't necessarily get diagnosed with ADD or ADHD is if they have more of the inattention or distractible type of ADD, where they're maybe more considered a space cadet or a little bit ditzy or a little bit, in the moon. These kids who are daydreaming or staring out the window, but they're bright enough that they can compensate for their being easily distracted. And so they go through life and they're kind of always a little bit on the moon, but nobody diagnoses them because they're not troublemakers. They're not acting out. They're not pacing around and disturbing the other children in school. And because they're not making any trouble, nobody really notices them. But they suffer and they struggle. I just diagnosed a woman in her late 60s recently, and she never got diagnosed because she's very, very quiet. And there's some other reasons which I'll get into in a minute. But because she never was diagnosed, she's always struggled to accomplish tasks. She'll start something and she won't finish it, or she'll want to start it and she can't get around to it. And she was always in a state of disorganization and everything was kind of a mess. And as soon as we started treating her for her ADD, all of a sudden she can focus, she can concentrate, she can start things, she can finish them, she can start the next project, she can finish that. She feels like her life has been transformed, and it's only because she's got this diagnosis. But because she was so quiet, and for some other reasons, which I'll get into in a minute, nobody ever thought to diagnose her or to test her and then give her the proper diagnosis. So being smart, and especially being smart and quiet, is one reason why people don't get diagnosed with attention deficit disorder. Another reason why people don't get diagnosed with ADHD or ADD is because they have childhood trauma. And childhood trauma causes a lot of disturbances in the psyche that are very similar to ADD or ADHD. Distractible, poor focus, poor concentration, restlessness, agitation, irritability, disobedience, acting out, difficulty with learning. All of these things that are caused by trauma can also be caused by ADD or ADHD. So when people are dealing with their trauma, nobody's thinking about any problems with attention or focus. And so there have been cases in my practice where I've been dealing with trauma with somebody for many years, and once their trauma was resolved, they're still having terrible difficulties with focus and with organization, with paying attention, with concentration. And then we go, let's look at ADD diagnosis. And sure enough, some of them have it, but no one was able to actually see it because we couldn't tease out the attention issues from the trauma issues. And trauma is one of those things that's very good at masking other kinds of disorders because it's so all-encompassing, it's so overarching that another diagnosis could be missed. And this diagnosis, such as ADD or ADHD, can be treated and it can cause a lot of relief if it's treated, but it's so hard to identify when the trauma is masking or obscuring the specific symptoms of ADD or ADHD. So to sum up, there are two reasons I think that it's hard sometimes to diagnose people with attention deficit types of disorders. And one is because they are more of the distractible and poor focus, as opposed to the more hyperactive type, and they're more quiet, they're not causing trouble in school, and also because they're smart. So smart and quiet, they're not going to be noticed because their grades are okay and they're not making trouble. And the other kind of person is the person who's got so much trauma that the ADD or ADHD diagnosis gets buried under all of the layers of other symptoms that are trauma related. And it's only until the trauma issues are more fully resolved that we can see that there are some actual learning disabilities there that can be addressed more specifically. So if you have had difficulties being organized, if you're always losing things or being very forgetful, if you have a lot of difficulty in keeping your attention on tasks that are boring, and especially things like filling out long forms, doing your taxes, or applying for passports or things like that. If you've had difficulty sitting still, if you're always a little bit restless or fidgety, especially in a meeting, if you're very forgetful, if you're absent-minded, maybe you're not a ditz, maybe you're not a space cadet, maybe you're not stupid, because a lot of these people with ADD, ADHD think that they're stupid. It has nothing to do with your level of intelligence. Perhaps you have attention deficit kinds of issues, whether it's ADD or ADHD with the hyperactivity piece. And as we get older, the hyperactivity piece is not so much like those kids acting out in school. It can just be feeling restless, not being able to sit still, not being able to do a quiet activity like a Sudoku or a crossword puzzle or a jigsaw puzzle or knitting. Those kinds of things might just not be the kind of things you can do because you can't keep your attention on that kind of quiet activity. You need a little bit more stimulation. If you need to, go to bed with your earphones on to have music because your mind is racing, all those things might be a hint that you might have ADD or ADHD, and you should speak to your doctor or your mental health professional, because there are some very simple tests to identify whether you do have it or not, and then there are treatments that you can follow which could perhaps change your life very much for the better. This is Dr. Marcia Sirota talking about the difficulty sometimes of diagnosing attention deficit and attention deficit hyperactivity disorder, and some very simple ways to find out whether you do have it or not.